Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is what you need to know about acute and chronic back pain. Over 90% of Americans experience back pain at some point during life. Regardless of whether or not treatment is sought, 90% of that back pain gets better within 6 to 12 weeks. So that's the good news. Unfortunately, that means 10% will end up with chronic back pain. The definitions are as follows. Acute back pain is 6 weeks or less. Subacute back pain is 6 to 12 weeks, and then chronic is anything over 3 months. It's the second most common reason people go to see a doctor, just behind the common cold. Half of all working Americans admit to having back pain every year. It's the most common cause of worldwide disability, and the direct and indirect cost of back pain is about $100 billion a year in this country alone. Okay, so the causes of back pain we're going to discuss that are soft tissue or, quote, hard tissue, okay? So for soft tissue, far and away the most common cause is a back sprain or strain, more than all other causes combined. And this may include a weekend warrior activity such as soccer, football, or simply moving, lifting heavy boxes. You just sprain a ligament or strain a muscle, and that can, cause you pain for a few days. When you look at the normal intervertebral disc, it's about 80% water. It has two layers, the outer annulus and the inner nucleus. As we age, a person can start to have disc degeneration. You can see this on the cartoon here. You have a healthy rectangular disc, and then it starts to degenerate and bulge, and this can cause pain because this outer layer has nerve endings in it, and that can cause back pain if there's degeneration. So when you have bulging disc, let's actually look at the right side first. You have a tear here in this outer part of the disc due to degeneration. That can be very painful because there are nerve endings here. There are none in here. Here's a herniated disc where you have a piece of disc that has come out and is pushing on the nerve root, and that can cause leg pain, known as sciatica, but it can also cause some back pain because of the irritation of the outer layer. Here's sciatica. You have 3 nerve roots that come out and make up the sciatic nerve. If one of these is getting pinched, such as here, with a bulging disc, then that can cause pain to go down the back of the leg or the side of the leg. It all depends on which nerve root is being pinched. So looking at the bony causes of back pain, arthritis is by far the most common. Okay, there are these joints in the back of the spine called the facet joints, and there's a lot of them. There's about 40 some of them from the neck all the way down to the sacrum. And they have cartilage just like any other joint that's mobile, and that can get degenerated and cause pain. The SI joints, there are 2 of them where the sacrum meets up with the pelvis, okay? And they do have some cartilage and have slight motion, and those can become arthritic and painful as well. Adult scoliosis can cause pain because you get asymmetric arthritis, and that can lead to a curve. Okay, so you can end up getting significant back pain from that arthritis, and possibly some leg pain too, because this concavity pinches on nerve roots as they try to get out. So this person would be most likely to have leg pain on this side. Spondylolisthesis is a fancy name, but spondy means spine and listhesis means slip. So what you have is, from an arthritic process, one level of the spine starts to slip on the level below it. And that can lead to back pain. It can also pull on the nerve root that was normally coming out here, so it can cause back pain and leg pain. Spondylolysis basically means, spondy means spine, lysis means fracture. So basically, here's the area here. It's called the pars interarticularis. It's just an anatomy term. But you get a stress fracture here in the level of the spine. It's most common in adolescents and college-age folks who are participating in gymnastics or football or some activity where they're constantly extending their spine. Okay, so normally a brace will help, and stay away from activity for 4 to 6 weeks. A lot of times this just kind of burns out and gets better. Spinal stenosis is when the overgrowth of bone and soft tissue from arthritis can lead to pinching of nerve roots. So it's not usually a cause of back pain, but it can cause buttock and thigh pain, but the arthritic process can lead to back pain. Uncommon causes of back pain include infection, fracture, which is not really that uncommon. I mean, there's about 1 million compression fractures a year now in this country, so it's not as uncommon as you might think. And then tumor. The top non-operative pain management for your back pain in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 different treatment options with the board-certified doctors. For the Austin area, visit us online today at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.